Some special points of interest about the sense of olfaction. One thing is, the amygdala. In olfaction, this is the one, this is a part of limbic system. I told you one olfaction, the efferent will bring about, results in your GIT secretion, or it depends upon the type of smell you are inhaling. And another thing is the sexual pathway. So amygdala in olfaction processes the pheromones. Now the different categories: pheromones, allomones, chiromones, right? Pheromones means the volatile hormones, or you can say that smell, erotic smell, some from the same species. And cross species is called allomone, and chiromone is cross species where the emitter is harmed and the sensor is benefited. So these are about the chirome, different type of smells which is perceived by the amygdala. Now uncinate fits is also important point of interest, that if there is any lesion in the lateral olfactory area, right, that's entorhinal area, may cause temporal lobe epilepsy, right, or uncinate fits. These fits are imaginary disagreeable odors with involvement of tongue and lips. If somebody has this history of some injury or an lesion in the temporal lobe, so you might find that this person sitting idle keeps on making faces, grimaces, as if he is smelling something obnoxious, and those fits will be seen with the help of, you can see he's making grimaces with the help of his movement of tongue and lips, as he's smelling something disagreeable, and this keeps on happening with him, and that's called uncinate fits or temporal lobe epilepsy. Clinical significance of olfactory. Now, first of all, learn the terminology of different clinical signs. You have anosmia, like loss of smell is known as anosmia. Now anosmia can occur either on one side or on both the sides, so this has to be checked separately, right? So power of smell is always checked with two on the two different nostrils separately. So anosmia can occur on both sides or on a single side. Olfactory dysfunction can be total anosmia और incomplete भी हो सकता है, partial anosmia जिसको hyposmia कह सकते हैं और microsmia कह सकते हैं. Distorted smell is dysosmia or can be characterized by spontaneous sensations like phantosmia, right? Spontaneous sensations. And inability to recognize odors despite a normal functioning olfactory system is termed as olfactory agnosia. Right, everything is working fine here, your olfactory pathway is intact, and still person is not able to smell. That is called olfactory agnosia. Now this can happen because of nasal congestion, because if the air, the volatile जो pheromones हैं, aroma है, that doesn't touches the nasal mucosa. This can happen in such conditions, like where there is nasal congestion or rhinitis, allergic rhinitis and all. So that can be condition of olfactory agnosia. Hyperosmia is a rare condition typified by an abnormally heightened sense of smell, right? Over smelling, destruction of olfactory bulb, right, and primary cortex Brodmann area number 34 results in anosmia on the same side of the destruction, right? So this can happen with any fracture of the front of anterior cranial fossa or any tumor, meningioma and all, where olfactory bulb down below, these are the olfactory nerves attached, and they can easily get torn out if there is a fracture there or any lesion. So that can lead to anosmia on the same side. Irritative lesions of the uncus results in olfactory hallucination. irritative lesions of the uncus, olfactory hallucinations, right? And that can also lead to temporal lobe epilepsy, as I told you, uncinate fits also. Damage to the olfactory system can occur by traumatic brain injury can be one cause, cancer or any infection or inhalation of toxic fumes which might damage to the neurons there in the nasal mucosa, or neurodegenerative disorders such as Parkinson's or Alzheimer's disease. So these are the various conditions in which there might be damage to the olfactory pathway. Okay. Now causes of olfactory dysfunction क्या हो सकते हैं? One is advancing age. So age is the strongest reason of olfactory decline in a healthy adult. I told you initially that there were around 16 to 20 million neurons in the nasal mucosa, right? And this number of neurons, this keep on decreasing with time and age. So age is one important reason for loss or decreasing loss of smell. The increasing loss of smell keeps with age. So age is one of the strongest reasons. Then the basis of age related changes in smell function include closure of cribriform palate is one, because ossification keeps going on with the age. So these are minute foramina in the cribriform palate. If they are being ossified, the number of nerves reaching to the olfactory bulb will be reduced in count. So one reason is closure of cribriform palate, and cumulative damage to the olfactory receptors from repeated viral or other insults throughout the life. And when throughout the course of life you must have faced rhinitis, any allergic infections of the neural mucosa, any pungent strong smells if you are working in such an atmosphere. So these type of irritative lesions might also keep damaging the nasal mucosa with age. So that's all which counts. Like ultimately with age you find that is decrease of power of smell. Viral infection is the most important cause. If it say is about loss of smell or decreased amount of smell is viral infection. Remember, it is the most important cause of permanent hypoosmia. What is the most important cause of permanent hypoosmia? That is viral infection. And anosmia are upper respiratory चाहे इनको अपर रेस्पिरेटरी इन्फेक्शंस कह सकते हैं, ठीक है. तो दोज आर एक्चुअली वायरल इन्फेक्शंस लाइक वायरल राइनाइटिस. सो परमानेंट हाइपोऑस्मिया के बेस्ट कॉमन रीजन में ये आता है, रेस्पिरेटरी इन्फेक्शंस, URTI, वायरल इन्फेक्शंस. Exposure to toxic chemicals, chronic exposure to some airborne toxins such as herbicides, pesticides, solvents and heavy metals. This can be an industrial hazard also for the people who are working from a long time in such hazardous toxic chemicals because of the long time inhalation of these irritants that can also damage the nasal mucosa. Head trauma. Now, head trauma, occipital and side impact causes more damage to the olfactory system than the frontal impact. This is very important. There's a recoil, there's a brain floating in the skull. So if you bang with your frontal bone onto while during an accident, if there is a trauma on the front of the skull, there are more chances of visual damage, because visual pathway, or the you can say occipital lobe, that is posteriorly, so the brain actually hits the occipital bone. So, and in case if there is a trauma to the posterior aspect of the skull, there it's the more chances of olfactory damage. So occipital and side impact causes more damage to the olfactory system than the frontal damage. And of course, if there is a fracture of the front of skull, or you can say base of anterior cranial fossa, there will be CSF rhinorrhea, because CSF will start leaking to the cribriform palate, and there will be CSF coming out to the nose. So this CSF rhinorrhea. Got it? So these are the reasons of head There are some reasons of olfactory dysfunction, and neurodegenerative diseases includes Alzheimer's and Parkinson's, which also slowly cause loss in or of smell. Okay, so that was all about the olfactory system. I hope you have understood. If you've still not understood, you can revise from the same lecture. Okay, thank you.